Now coming to pathophysiology of stroke, as we have already discussed that stroke can manifest either as infarction or hemorrhage. So there are different mechanisms for each. Now coming to infarction first, let me draw a simple line diagram of brain here first. That's the brain. These are all the blood vessels supplying the brain, and let's say this artery is blocked, or so that blue dot you're seeing is the area of brain which is death because of the cessation of blood supply, as infarction means a cessation of blood supply. So we'll zoom that area and see what is happening in that area. These are the blood vessels again, and this is the cut. Here we see a triangular area behind the area which has already died, and this area is known as ischemic penumbra. This is the area which has less blood supply as compared to the previously before the vessel was patent, but this area is in the risk of dying, and this is the main area which we save by thrombolytic therapy or whatever measures we take, which we'll see in treatment. So the normal blood supply is 50 ml per minute per 100 gram of brain tissue. However, when this falls to less than 20 ml per minute per 100 gram of brain tissue, it results in cessation of electrical activity, and the symptoms appear, but the cells is still alive at this stage, and reperfusion would reverse the symptom. However, when it falls less than 10 ml per minute per 100 gram of brain tissue, it results in rapid neuronal death. Now this is a gradual process in case of thrombotic stroke. However, in embolic stroke it is a sudden process which is more dangerous, as the neurons don't get time to adapt themselves to the low blood supply. Now let's see what makes the brain cell dead after the cessation of blood supply. So that's a cell, and due to the cessation of blood supply there is hypoxia, and which causes decreased ATP, which leads to failure of membrane pumps, and thus sodium and water enters into the cell, which releases glutamate into the extracellular fluid. And this glutamate, when it goes out, it channels of sodium and calcium, which allow them to come inside. And also there is anaerobic respiration because of hypoxia, so this leads to increase in lactic acid of the cell, and this all makes the cell die. Now moving on to the hemorrhagic stroke. It results from rupture of blood vessel in the brain parenchyma or in subarachnoid space. So let me again draw a simple line diagram of brain here, and that's the brain, and these are the blood vessels which supply the brain. And let's say this area is involved because of rupture of blood vessel. So as soon as the blood explosively enters into the parenchyma, the neurons lose their function because of structural disruption and due to splitting of white matter fibers. In addition to this, the hemorrhage itself can expand in size and may act as a mass lesion, compressing a part of brain and causing progression of neurological deficit. As you can see here, if the hemorrhage expands in size, it will press upon the part of the brain and it will lead to worsening of the symptoms. Also, since the blood supply to the neurons is also affected, the neurons die in the same way as due to hypoxic injury as we have seen in the case of infarct.